All right, let's turn attention now to health matters. The civil society in malaria control, immunization and nutrition is pushing for more intensity towards achieving results in malaria control and elimination. These experts at a quarterly advocacy meeting believe that the recent global fund allocation of $90 million towards fighting malaria, tuberculosis and HIV can be used to turn this situation around if properly utilized to strengthen efforts towards tackling this issue. Kemi Balogun reports.
The World Health Organization estimated that half of the global malaria deaths were recorded in 6 countries, with Nigeria accounting for 25% of the world's entire malaria burden. Although Nigeria has come a long way in achieving commendable results, given the resources put in by global partners, a lot more needs to be done in terms of interventions to turn this figure around. Community-led monitoring is one way to go. This would be achieved by paying a lot more attention to community involvement and ownership of interventions, with a new funding model to carry out interventions in 13 states across the country.
You have rain for 3-4 months of the year, and those 3-4 months will have a high prevalence of malaria. So what the seasonal malaria chemoprevention does is that during those few months, the children under 5 will be given prophylactic medicine for malaria.
The 2020 malaria report, we see that a lot of improvements have been attained, even we are not there yet. We believe that when you play your part, when I play my part, when we all collectively play our part, the fight towards malaria elimination.
Funding remains an issue, as even with grants, effective utilization can still be a challenge. There is the desire to improve this through increased national, state, local government and community investment and ownership of malaria interventions.
We can keep doing the good work, not just at the national level, not just at the state level, but also at the facility level.
If our communities, both in the rural areas and the urban areas, can do this, keep our environment free of stagnant water, there will result in less incidence of malaria.
As interventions reach communities, residents themselves also have been advised to play their part in stopping the spread of mosquitoes. Malaria endemic countries remain the poorest ones, and this disease will continue to be a source of poverty when interventions and fundings are not utilized effectively. Kemi Balogun, TVC News, Abuja.